My name is Dr. B, the Medical Director, Expert Holistic Healthcare Services. And we do a lot of natural therapies. We do acupuncture, naturopathy, organic medication, chiropathy, just name it, all to get healing. Hello class.
Good afternoon, ma'am.
Good afternoon. So today we are having a very important class. And I want you to pay attention. A lot of patients come in, and when you ask them, what's your menstrual cycle? They don't know. When was the last day you saw your menses? They can't recollect, and they are looking for fertility. Times I wonder how possible it is. So this makes it necessary for me to bring this topic to you. So I want you to pay attention. If you're a man, you should also pay attention to this because it is very important. You can support your wife. You can also track her ovulation for her. Is that okay?
Yes.
Now, the topic is menstrual cycle and ovulation tracker. Whenever you see your menses, the first thing you have to do as someone who is looking for a baby, you're looking for a child, is to go and record that day. Get your jotter, get your calendar. Make sure you circle that date. Now, let's assume this person saw her menses on the 3rd of January. Now, I've marked that January for the person. Now, your menstrual cycle, you want to calculate this person's menstrual cycle. Now, that day that you saw your menses is day 1. So, you count from that day. Even if it's in the evening, count from that day. Day 1, day 2, day 3. Down to when you see the next menses, you circle again. This same person see menses again in February on the 28th, you circle that day. In March on the 27th, circle that day. Now let's calculate the cycle of this patient. Now from that day, remember I said the first day of the menses is day 1. So you calculate 1, 2, 3. If you calculate this down to this place, you get what? 28 days. So this person now on the 31st started seeing menses. This is same January, but this person is seeing menstruation twice. Can you see that this person is normal? Nothing is wrong with this person. But some persons complain. They come and meet us. Hey, I'm seeing my menses twice, but calculate it. Now we'll still continue. Now, when the person starts seeing his menses, now from day 1 to the last day before the day you saw the next menses is called your cycle. So how many days do we have here? 28 days. Now let's go down to February. Now the day you saw your menses on the 31st of January again, you count from that day. You have day 1, day 2, day 3, like that. You calculate down to on the 27th, it becomes your 28 days. Another 28 days. You now saw it on the 28th of February. Good. Now that day you now saw it in February, you circle it and you start counting from what? 1. You count like that. So you see, when you count in February again, you continue 3, 4, 5, 6, 7 down to this place. You have 28 days. On the 27th, will now be number what? Number 1. You start counting. So the first day you saw your menses down to the last day before the next menstrual date is called your menstrual what? Cycle. So Mrs. A, her menstrual cycle is what? 28-day cycle. Now we go into ovulation tracking. Now if this person have a 28-day cycle, when is she likely to ovulate? Because you have to understand your ovulation and your fertile period for you to know when you are ready or when you will be likely to conceive, if there are no other associated fertility challenges. Now, if Mrs. A have 28 days cycle, menstrual cycle, minus 14 will give us how much? How many? 14. So our ovulation date is what?
14 days.
Good. So on day 14, counting from this day, is supposed to be her ovulation day. Now let's calculate. No, we already have our calculation here. From this day, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So when is this day?
16.
No, on the 16th. Good. This is our what? This Mrs. A. She's ovulating. Although we also use ovulation tracker. There's a test just like the pregnancy test that you used to check. Now she is ovulating this day. Are you seeing the signs there? No rocket signs. Now another one again. This is another menstrual date. Count from there till on the 14th. This is her ovulate. She's ovulating this day. Where is another 14? Ovulation. So if she meets with her husband this date, what will happen? Conception will happen. Isn't it? Conception will happen. Now, if a man have sex with a woman before this ovulation period, 5 days before the ovulation period, fertility is likely to happen. So there's possibility that person will still ovulate. Let me show you. Now we said day 16 is ovulation, isn't it?
Yes.
Now let's go to, this is ovulation. Let's see, 1, 2, 3, 4, 5. What is happening? If this woman has sex with her husband in this date, till this date, down here we add one more day. Okay. These 7 days is called her fertile period. All these ones are safe period. She sleeps with a man this period, she might not have become pregnant. But she will not become pregnant. But you see from here, this date, anything that happens this date results into fertility. So imagine Mrs. A, she's looking for fertility. And with these dates, she's quarreling with her husband. They are not talking. They did not have sex. Will fertility happen?
No, ma'am.
Or within these dates, Mrs. A now traveled, or the husband traveled. Will fertility happen?
No.
So you see the reason why they miss out. That's the reason why they miss out in fertility. At times they don't have, nothing is pursuing anybody, but because they are not taking cognizance of this. So if you have this video, share to another person who is looking for a child. Now, it's very important I mention this. This ovulation date, it takes between 12 to 24 hours for ovulation to take place. So between these hours in this date, you did not meet with your husband, or Mrs. A did not meet with her husband, fertility will not take place, isn't it? Or backward to the fertility days, no sexual intercourse, fertility will not take place. So it takes just 12 to 24 hours to conceive for this. Now there's also a natural method. We also work on this to get the sex of a child. That will be in our next video, not today. So this is just the short one I'm sharing with you. Please share. Very important. Thank you and God bless you.
Thank you, ma'am.